types of healthcare directives with which to become familiar: healthcare proxy or durable power of attorney for healthcare, living will, and medical directive. And each of these have a different but related function, and each carries a distinct legal significance in various states. With the healthcare proxy, you appoint an agent to carry out your wishes. Living will, it dictates the withdrawal of life support under certain circumstances. And a medical directive provides instruction in non-life threatening situations. And here to discuss all those documents with us in a series of interviews is Harry Margolis, author of Get Your Ducks in a Row. Harry, welcome.
Thank you, Bob. Glad to be here.
It's a pleasure to have you here. Let's start with healthcare proxies or durable powers of attorney for healthcare. First of all, can you define what it is?
Yeah, and the terminology it gets very complicated for all these things because different people use different words and different terminology, and different states have different terminology. So, for instance, with healthcare proxies and durable powers of attorney for healthcare, they're essentially the same thing, but some states will use the proxy word, and some people use the power. Some states say power of attorney, and that's all by statute. But whichever one they're using, it's pretty much the same thing, where you're appointing an agent to carry out your wishes if you're unable to, your healthcare wishes. So, if you become incapacitated, that person basically stands in your shoes, and the medical personnel are supposed to talk to that person and get guidance from that person so that they can carry out your wishes.
Right. And it strikes me that some of the responsibilities of this agent, or what is sometimes called an attorney, in fact, is to confer about treatment, about the extent of treatment, about whether surgery is performed, what medications might get prescribed, et cetera.
That's exactly right. So all medical decisions, but some things get a little bit into a gray area. So certainly whether you're in a hospital or not in a hospital and where you're receiving treatment, that's a medical decision. But where you live is not so much. So say you want to be home, but you're going to be safer in assisted living or in a nursing home. Does the healthcare agent have the ability to make that decision for you? And that might depend on your state, because that, as I said, is a little more of a gray area about it's not strictly speaking a medical decision, but it's related to healthcare.
Another gray area, it seems, and we'll talk more about this later, I think, with DNRs, et cetera, is this notion of life support and whether one can terminate treatment if you're in a permanent vegetative state, or whether you need life support or not. Does the agent have the ability to make those decisions?
In most cases, it may differ from state to state, but essentially your agent should be able to make that decision for you. There are other documents which we'll talk about, such as a living will and a MOLST, which may affect that. But your agent is supposed to be able to stand in your shoes and make those kinds of decisions.
Right. And then one of the triggering events in order for the agent to sort of assume this authority is that a doctor has to deem someone incapacitated or not legally competent. And that technically is the doctor's decision?
That's the doctor's decision. Now, the individual can challenge it. So say a doctor has said that you no longer have capacity, you become incapacitated, and you disagree. You can certainly go to court, or you can in effect fire. You can sign a document rescinding the healthcare proxy or the durable power of attorney, and then it just ends up having to go to court to decide whether you actually have the capacity to repeal or rescind the appointment of your agent.
Yeah. A second ago, Harry, you mentioned step in one's shoes, and in the book that you wrote, you mentioned the phrase substituted judgment. Maybe drill down a bit on that.
Yeah, so substituted judgment. So the idea is your agent is supposed to substitute for you and make the decision you would have made in that circumstance. And that's the concept of substituted judgment. And the question is, how does the agent know what you would have wanted? In some cases, you have a close relationship, you've talked about these issues, and they have a pretty good idea of what you would want. But there have been studies of this, and they found that most people don't have that conversation, unfortunately. And so what happens is that the agent, in most circumstances, actually applies their own judgment. Hopefully you picked an agent whose values are similar to your own, and their judgment would be yours. But unless you've actually had a conversation, or completed some other documents that guide the agent, then they may not actually do what you would have wanted to do in that circumstance.
When you talk about naming an agent, should one have one particular agent or multiple agents or one agent and a successor agent?
Yeah, that's a great question. So some states are say you can only name one agent. Other states don't specify. We feel in our practice that it is important to just pick one, because otherwise, if you have more than one, there can be a lot of confusion. There can be disagreement, and then no one can make a decision. So it's important to name one, but you can name a successor because the one you appoint may not always be available. It's also, I think, important to have one because very often there's a lot of confusion in terms of getting medical information. So especially if you're hospitalized, you're in the hospital 24/7. The nurses and doctors are coming through, and often family members are there attending to you when they can, but they may talk to different specialists and get different information. And it's a little bit like the old tale of the blind men and the elephant. They're all getting a little piece of the story, but they're not putting it together. So it's important to have one point person who is ultimately going to get all the information and can put it together rather than pieces of it. So even if your state allows you to appoint more than one, we'd recommend appointing just one.
And the obligations of the agent, not unlike being perhaps an executor of an estate, they can be time consuming, especially if you're living out of state and there's a need to be on call 24 hours a day to talk to medical professionals.
Yeah, no, I mean, when you have to step in, it can be very time consuming, especially during a hospitalization. Or if somebody's in a long-term decline, it can be episodic that you have to make decisions over time. So it's a burden. Being local can help, especially if somebody's in the hospital. But these days, with video calls and internet and all that, it's not necessary. So if you're trying to choose who to appoint, I think proximity is a factor, but I don't think it's by itself a deciding factor.
And I think you might have mentioned that the powers vary by state. Is the variation really dramatic? Do people need to sort of?
No, I think there are so as we said, different statutes and some differences, like whether you can appoint one or more. I think one thing that's different from state to state is what happens if you haven't appointed anybody. So some states have a list of people who can step in, say your spouse first, and then your parents if they're alive, and then your children. So kind of a priority list. Other states, such as Massachusetts, where I practice, if you haven't appointed anybody, nobody can step in. You would have to go to court and get a guardianship. So that differs significantly from state to state.
Right. And if you by chance live in one state in the winter and another state in the summer, do you need two healthcare proxies, one for each states where you might be residing?
We think it's a good idea. Now and I would hopefully appoint the same people or person on both. Technically, it's not necessary. There's the Full Faith and Credit Act of the Constitution, which says that every state's supposed to honor the laws of other states. So if you have, again, I'm in Massachusetts, if you have a Massachusetts Health Care Proxy, but you're spending your winter in Florida, Florida is supposed to honor the Massachusetts Health Care Proxy. And that's the law, but the reality is everybody's familiar with their own forms. So, and every state's forms are a little different. So if you're going to a Florida facility or medical provider, and you present a Massachusetts healthcare proxy, they may look at it and say, well, we're not familiar with this. We're going to have to send it to our lawyers or something to evaluate, which is going to cause delay and difficulty. But if it's the Florida form, they're probably going to say, oh, we're used to that, and we'll honor it. So if you really are kind of spending half the year in both places or a lot of time in both places, I'd execute the healthcare directives in both places.
Right. And I suppose it's worth noting, though it may seem obvious, that a power of attorney for healthcare is vastly different from a power of attorney for financial matters, which requires much more formality than, say, a durable power of attorney for property management.
Well, they both require formality. In some cases, different formalities, whether you need witnesses or notaries, but they're just totally different subject areas. So that's the difference. So you may appoint the same person on both, or you may say this person is pretty good for healthcare matters, but I wouldn't want them to handle my finances, and another person may be pretty good at finances, but maybe they're not quite as compassionate, and you don't want them as your healthcare agent.
Yeah. And there's some debate, Harry, around whether the healthcare proxy should contain a HIPAA or whether you should just have a separate HIPAA so that the agent can talk to doctors. Any thoughts about that?
I would do both. So the healthcare proxy or power of attorney should include a HIPAA release. Some states you don't need it just because just the appointment of someone constitutes a HIPAA release, but I'd have it in the form in any case, or we do in our practice. But while we always counsel appointing one person on the healthcare proxy, we do a separate HIPAA release where we suggest to our clients that they appoint a broader range of people. Say if you have 3 children, you may appoint one as your agent, but authorize all 3 to talk to medical personnel. And this is for a few reasons. First, it's to facilitate communication. So we haven't seen it as much lately, but especially early on when HIPAA was enacted, we would have experiences where clients would go to the emergency room and they'd be there with their children, and the medical personnel would say, well, we can't talk to you because we don't have a HIPAA release. And that meant that they wouldn't even talk to them to get information from them. Now, HIPAA doesn't say that medical personnel can't take in information. It just says they can't share it. And it can be very important that they hear what the medications the person is taking. Someone presents in a emergency room being incapacitated or a little loopy, and they don't know, the people in the emergency room don't know that that's not their baseline, how they normally are, that they were driving and playing tennis the day before, unless someone tells them. And so you don't want to have this artificial barrier to communication, and the HIPAA release can be a way of getting over that, because you don't know who's going to be there with the individual. And again, while it's important to have a point person to get all the information and make decisions, they're not always available. So it's good so even though you want ultimately one person to take in all the information, if other people can help and collect information, that's important too. So we always counsel appoint everybody you're comfortable with sharing your medical information with on the HIPAA release.
So let's cover some of the basics. Where do you find one to complete? How much does it cost? Where should it be stored? Who should have a copy of it? Should the agent and your doctor have a copy of it? How often should you review these documents?
So most states have forms, whether it's a statutory form or just one that's commonly used. So you should be able to find these online. And also when you do go to a hospital, they're supposed to talk to you about it and give you the opportunity to prepare one at that time, or to sign a healthcare power of attorney or healthcare proxy at that time. But if you already have one, don't do it, because then you could have a lot of sort of dueling documents, and you may, by mistake, name different people. But they usually have forms available. And then if you are doing estate planning with an attorney, in general, these days, they will prepare these for you as kind of part of the process to have a complete estate planning package and make sure you're taking care of everything.
And should it be stored in various places with your agent, with your doctor, with your records?
Oh, certainly. Again, if you're working with an attorney, they'll have a copy. It's good to email it to everybody, that anyone you've appointed, and then have a copy yourself wherever you keep your other important documents, so family members can find them. And And you can share it with your doctor. To be honest, I don't know how much they want to have these extra these documents or not, but you can certainly offer to them, and if they can store them and have a way of doing that, that's great.
Yeah, and I suspect you should review them every so often, in part because maybe your life circumstances have changed, your agent is no longer alive, or maybe you've had different thoughts about who should be your agent.
I think especially the older you get, the more often you should review them, just because, again, things are likely to change more often, and it's more likely that it's going to have to come into play. So, so if you're younger, or say if you're under 60, maybe every 10 years, every decade or so, take a look at it, and maybe once you get over 60, do it every 5 years, I would say.
So, Harry, we plan to do a series of interviews on these legal documents that caregivers and recipients of care need: medical directives, living wills, DNRs, HIPAA releases. We'll drill down a little bit more on, and also what's called the medical orders for life-sustaining treatment. But before we wrap up, anything we missed, or anything that just bears reemphasizing?
I think we've pretty much covered the field, and when we get to the other documents, we'll cover some of the related issues.
All right, Harry. Always a pleasure having you share your knowledge and wisdom with us.
Thank you, Bob.